Hi, and welcome to Plexus Ortho. My name is Dr. Kannan Kumar. I am an orthopedic consultant at Bangalore, and today we're going to discuss about one of the MCQs that I put out earlier today. The question goes like this: So, what type of deformity is seen? What type of deformity is seen at the elbow due to the fracture shown in the X-ray? So you can see that something is wrong over this area of the elbow. This is the lateral area of the elbow, and so therefore this is the lateral condyle or lateral epicondyle. So you can see there is a fracture line which is going through it. So it's most likely a lateral condyle non-union. So what happens in lateral condyle non-unions or lateral condyle fracture? What is the deformity that occurs later? The deformity that occurs is cubitus valgus. Most of you have got this question correct in the Telegram channels, and so therefore I'm happy about that. So cubitus varus, where does cubitus varus occurs? It most commonly occurs in supracondylar fractures. Supracondylar fractures are far more common than lateral condyle fractures. About 90% of all elbow fractures in children are supracondylar fractures. About 10 to 15% of the cases are, lateral condyle fractures, and this may cause a cubitus valgus deformity later in life. Elbow flexion deformity and extension deformity can occur in both the fractures, but the most likely deformity that is likely to occur with lateral condyle fractures is cubitus valgus deformity. So coming to a couple of important key things regarding this MCQ is that you should all know the appearance of the ossification center. So appearance of the ossification center. The sequence in which it appears is a very important question, has been often asked, is very frequently asked. So you must know this. So what is the um, abbreviation and what is the mnemonic to remember it? It's called CRITOE, CRITOE, CRITOE. C for capital M, so the appearance, it appears at 1 year of age. The ossification center appears at 1 year of age, radial head at 3 years of age. So it's all odd numbers, 1, 3, 5, 7, 9 and 11. So remember that. And internal epicondyle or medial epicondyle appears at 5 years of age. Trochlea appears at 7 years of age. Olecranon appears at 9 years of age, and external epicondyle or lateral epicondyle appears at 11 years of age. Now let's look at the lateral condyle fracture as such. The lateral condyle fracture is far less common than compared to the supracondylar fracture. This is a capitulum with the growth plate here. So the fracture runs through this area, and it's a very common fracture to undergo non-union. Supracondylar fractures undergo malunion, whereas lateral condyle fractures undergo non-union. Why does it undergo non-union? There are two reasons for it. One is, like the neck of femur, this area is bathed in synovium right here. It's a fracture passing through the joint, and therefore it has decreased blood supply, or the blood supply comes through the diffusion of the synovial fluid, and therefore it has poor blood supply and poor quality to heal. This is a lateral view of the lateral epicondyle, and the blood supply comes from the posterior aspect. It's a twig of a blood supply once this area is fractured. So therefore the blood supply is a little precarious, and therefore there's a higher chance for it to undergo non-union. So what is the main deformity that occurs because of the non-union here or malunion here? The elbow tends to become more valgus in shape. Let me erase that. So because of the malunion or non-union of the lateral condyle, the elbow tends to go into more of a valgus. So this is why it causes cubitus valgus deformity. What if it becomes more of valgus? What happens to the ulnar nerve that is behind here? The ulnar nerve gets stretched out. So what do you get? It is called as tardy ulnar nerve palsy. Is a very common complication of lateral condyle non-unions, is very commonly seen in your clinic, and therefore can be commonly asked as a question as well. So therefore what can happen? It's called tardy ulnar nerve palsy, very important complication of lateral condyle fractures. Because of its poor supply over a period of time, this area can become avascular or become avascular necrosis. This is called as avascular necrosis. And because of some kind of decrease or growth arrest, this can cause what is called as a fishtail deformity. So you have a deformity like this. So the lateral condyle becomes fishtail in appearance. So this is called as fishtail deformity. So when there have been these questions that have been asked in your CET, INI CET, so therefore you must answer it as fishtail deformity. Growth arrest can occur, but it is not a major problem. Why? Because we all know that in humerus, 80% of the growth occurs at the proximal portion and only 20% occurs at the distal portion, and therefore growth arrest may occur, but it is not a significant complication. So that is the question and that is the answer. The question was basically what causes this deformity. It is so it's first you have to identify. It's a two-step question. First you have to identify the fracture. It was a lateral condyle non-union, and the most common deformity is cubitus valgus deformity. Always remember this can also cause ulnar nerve palsy as well. Tardy ulnar nerve palsy. This is a delayed ulnar nerve palsy can occur with this. Fishtail deformity can also occur. Avian can occur. All these have been previous year's questions. So just try and understand a little bit about lateral condyle fractures. Thanks for hearing me out. I am Dr. Kannan Kumar from Plexus Ortho. We'll come back tomorrow again with another MCQ. Thank you very much.